Today, we're going to explore autonomic neuropathy, which is all about nerve damage and how it affects the involuntary functions of our body. These are the processes that happen automatically, like controlling your heartbeat, digestion, or even how you sweat. When the nerves responsible for these activities are damaged, it can lead to a variety of symptoms and complications. Understanding this connection helps us better grasp the impact of autonomic neuropathy on overall health and daily life. On this slide, I've outlined the key topics we'll be covering about autonomic neuropathy. We'll start by defining what autonomic neuropathy is and then explore the common causes and risk factors associated with it. Next, we'll look at how symptoms can vary depending on which body systems are affected. Diagnosis methods are also important, so we'll discuss how this condition is identified. Then, we'll move on to potential complications and warning signs to watch for. Treatment strategies will follow, including daily self-care and lifestyle adjustments that can support management of the condition. Finally, we'll cover long-term management and what the prognosis typically looks like. This gives us a roadmap to understand autonomic neuropathy comprehensively. Autonomic neuropathy refers to damage to the nerves that manage the automatic functions of our body. These are the functions that happen without us having to think about them, like controlling heart rate, blood pressure, digestion, body temperature, bladder control, and sexual function. When these nerves are impaired, it can lead to serious challenges in how the body regulates these vital processes. Understanding what autonomic neuropathy is helps us grasp why these symptoms occur and highlights the importance of proper diagnosis and management to improve quality of life. Autonomic neuropathy can result from a variety of causes and risk factors. The most common cause is diabetes, particularly when blood sugar levels are poorly controlled over a long period. Besides diabetes, other metabolic issues, like vitamin deficiencies, can also contribute to nerve damage. Autoimmune diseases and infections are important contributors as well, since they can trigger immune responses that harm the nerves. Additionally, toxic and hereditary factors play a significant role. Conditions like alcohol use disorder, exposure to certain medications or environmental toxins, inherited nerve disorders, and effects from cancer treatments or neurodegenerative diseases all increase the risk. Understanding these diverse causes helps us identify and manage autonomic neuropathy more effectively. Now, let's focus on how autonomic neuropathy can affect different body systems and the symptoms that might arise. Starting with the cardiovascular system, you may experience dizziness or notice a fast or irregular heartbeat. Moving on to the gastrointestinal system, common symptoms include nausea, bloating, constipation, or diarrhea. When the urinary system is involved, issues like retention or incontinence can occur. In terms of sexual health, autonomic neuropathy can lead to erectile dysfunction in men or vaginal dryness in women. You might also notice changes in sweating patterns or develop heat intolerance, which relates to the sweat and temperature regulation system. Lastly, abnormal pupil responses can indicate involvement of the pupillary system. Understanding these symptoms is crucial because they help us identify which body systems are affected and guide appropriate diagnosis and management. When it comes to understanding autonomic neuropathy, the diagnostic process begins with a thorough initial evaluation. This includes taking a detailed medical history, reviewing symptoms carefully, checking current medications, and performing a comprehensive physical exam. These steps help us pinpoint important factors contributing to the condition. Following this, specific diagnostic testing is conducted. Key tests involve measuring orthostatic blood pressure and heart rate to assess how the autonomic nervous system is functioning. We also check blood sugar levels through glucose and A1C tests, evaluate vitamin B12 status, and perform thyroid studies to rule out other causes. In some cases, targeted autonomic tests are necessary to get a clearer picture. Together, these evaluations guide us in accurately diagnosing autonomic neuropathy and planning appropriate management. When it comes to autonomic neuropathy, there are some urgent warning signs that should never be ignored. Severe dizziness, repeated episodes of fainting, and inability to urinate, chest pain, or significant weight loss all demand immediate medical attention. These symptoms can signal serious complications, If left untreated, autonomic neuropathy can lead to a range of major issues. These include falls and fainting, which increase the risk of injury, as well as dehydration and malnutrition due to the body's impaired ability to manage essential functions. Urinary tract infections can also develop because of difficulty emptying the bladder properly. Additionally, patients may experience silent low blood sugar episodes, where dangerous drops in glucose levels happen without the usual warning signs. There can also be problems with temperature regulation, making it hard for the body to maintain a stable internal environment. Recognizing these red flags early and understanding the potential complications is crucial for managing autonomic neuropathy effectively and preventing serious health risks. Now let's discuss the treatment strategies for autonomic neuropathy. First, cause-directed care is essential. This means we focus on treating the underlying cause of the neuropathy, which helps halt progression and improve symptoms. Alongside this, symptom-specific management targets the particular symptoms a patient experiences. For example, targeted therapies can help manage digestive issues, bladder dysfunction, and sexual symptoms, improving quality of life. Blood pressure support is also crucial, especially for those experiencing orthostatic hypotension. This can be managed through increased fluid and salt intake, wearing compression garments, or prescribed medications. By combining these approaches, we can offer comprehensive care tailored to each patient's needs. Autonomic neuropathy is a condition that affects the nerves controlling involuntary body functions. Managing it effectively involves adopting several key habits. First, rise slowly from sitting or lying positions to prevent dizziness and falls, and make sure to stay well hydrated throughout the day. Using compression stockings can help improve circulation when recommended by your healthcare provider. Eating smaller, more frequent meals supports digestion and overall comfort. It's also important to avoid overheating and limit alcohol intake, which can exacerbate symptoms. Regular, safe exercise is beneficial, but always monitor your body's reactions. For conditions like diabetes, meticulous tracking of blood pressure, blood sugar, and foot health is crucial to prevent complications. These daily self-care strategies play a vital role in reducing symptoms and improving quality of life. When it comes to long-term management of autonomic neuropathy, a multidisciplinary approach is essential. This often means working closely with specialists like primary care physicians, neurologists, endocrinologists, cardiologists, urologists, or gastroenterologists, depending on which symptoms are most prominent. The prognosis varies significantly based on the root cause, how quickly the condition is diagnosed, and how effectively it is managed. Importantly, early intervention can make a big difference by improving quality of life and helping to prevent serious complications down the line. So staying proactive and coordinated in care is key for the best outcomes.